All right, welcome to this video. Thanks for clicking. Today we're going to be talking about something pretty important. Have you ever visited the doctor for your free annual preventative exam and been charged for it? Or has this happened to somebody that you know? So this happened to me, and today in this video, I'm going to talk about some of the negative consequences that can result from this, the harmful effects on medicine and patient outcomes, and also explain to you what you can do to try to reverse those charges, as well as make sure this never happens again. So let's go ahead and get started. So today is December 14th. Last May 31st, I went in to see my primary care physician for a free annual preventative exam as per my insurance benefit. I look forward to this exam every year. I'm not 22 years old anymore, so this is an important conversation that I have with my doctor. However, my local hospital is quite big and they have lots of different physicians, so I happen to be seeing a resident physician that day, who is of course overseen by the supervising physician, who I did not see. So I went in and I talked to this doctor about my physical health. The doctor asked me a series of questions about my health, and I answered them openly and honestly. And by the way, it's worthy of mention that I scheduled this appointment under the idea that this was my free preventative exam. When I checked in, I said, I am here for my free preventative exam. And I even told the doctor when I first got there into the office, when he came in, hey, I'm here for my free preventative exam. Great. So I was in, I was out. The doctor asked me a lot of different questions. I mentioned something about male pattern bald. Hey, is there a cure for baldness yet? Ha ha ha, half joking. And also he asked how I've been feeling. I said, fine, I've got some, at the risk of revealing too much, I have maybe some athlete's foot on my foot. And he said, oh yeah, we can take care of that if you would like. And I said, I don't know, I've tried a lot of, meaning it was an open conversation about the status, the physical status of my health. And to my absolute horror, a couple of weeks later, I looked at my medical bill and I was charged $79 or $80. Not a lot, thank goodness, but there was a copay that I was charged for, as well as lab results that he had ordered. And I was shocked at this and I didn't understand why. By the way, let me start by saying I am a cheapskate, but not at the expense of good quality or good health, meaning I love doctors. Healthcare is very important. There is no better time to be alive in terms of healthcare and the quality of care that you can, I think, get. It's not the medieval ages, thank goodness. If you've got a problem, it's well worth it to go in and pay whatever it costs to make sure you are healthy, right? When you're talking about life and death, money is not important. But a free preventative annual exam, that's another story. So I got my bill and I said, what is happening here? And I emailed the billing department saying, hey, was there some type of mistake? I had my free preventative exam. What's going on here? And they replied with, let me read here directly from them, quote, per the doctor's notes, the following items were discussed and billed: male pattern baldness, annual physical exam, tinea pedis of both feet, so I think that's the athlete's foot, abnormality of the shape of nail, apparently he saw an abnormality in one of my nails, a family history of thyroid disease, okay. This created a patient balance due for co-insurance and copay after insurance was processed. Anything discussed during the visit that is not within the guidelines will create additional charges. Are you serious? Guidelines? What guidelines? I never got any guidelines. So that means I can't have a conversation, an open and honest conversation with my doctor, my primary care doctor, one time a year without being aware of some guidelines? What guidelines? This was not written down anywhere. It was not made aware to me, the patient, who, by the way, is a middle-class English speaker. If I don't have access to it, imagine other people that don't have access to it either. So I expressed my outrage and my concern about this and requested information about how to appeal these abhorrent charges. The billing department then responded with, quote, per review, coding has been reviewed and has been determined to be correct. Based on documentation, coding matches the services provided. There was a hospital fee of $44 and all lab services completed were coded as an annual preventative exam. The patient's insurance applied the balance to co-insurance. The physician fee, a copay of $35, was generated from insurance. This is under the umbrella of an office visit and not a preventative exam, as other concerns discussed during the appointment does not meet the criteria for a preventative only visit. Can you believe this? I don't have a problem with it if that's made clear to me up front or even during the preventative exam. But the problem is this was a very hidden thing, and I was surprise billed later for it. This has big problems and huge effects, negative consequences on healthcare and outcomes for patient health. Before I talk about those, let me explain what I did next. I contacted the actual clinic directly, not billing, but the actual clinic, to talk to the doctor. Well, that resident doctor had since moved on, apparently, but the supervising doctor was very nice, by the way, but he replied, if the intent was not to evaluate or treat anything in discussing these matters with the doctor, then there should have been no management of it. In other words, no prescription, no checking of iron in the labs that he ordered, no prescription of hair growth product. Wow. This is deceptive, and I have major problems with this. And by the way, there was a precedent of 10 years with this hospital of preventative exams in which I did discuss and answered the doctors from the question, and we had a great conversation for 10 years, and it was always billed as a preventative exam. There was never any evaluative exam billed for. But this time there was a problem. Why is that? So what I did after that, the doctor refused to reverse the charges, and they all stuck, unfortunately. So first of all, I wrote a letter to hospital administrators directly. This included the office. The hospital has an office for patients that advocates for patients, as well as I went to the associate vice president and the chief executive officer directly. And I wrote this letter and I asked it to be sent to these individuals. And in my letter, I explained exactly what happened. I explained kind of what I just talked about, how I'm a resident of the town. I've been with them for a really long time. I take these exams seriously, and this is kind of how the preventative exam went. I sat down, I answered the questions, we talked about this, we talked about that. And in my letter, I said, here is why this visit should be categorized as preventative only. Number one, your reasoning, the hospital's reasoning didn't make sense to me. The billing department said it was the topics that we discussed, but the supervising doctor blamed the prescriptions, by the way, which I never filled because I didn't really need them, and the labs, which I thought were preventative orders. I didn't know what iron, oh, we need to check for iron. That's an evaluative piece. Like, I'm a patient, I don't know about iron. And both of these answers implied that it was my fault, that I somehow deceptively went in there looking to get evaluative treatment under the guise of preventative exam, which is complete hogwash. I also explained that there was a precedent, that I have been doing this for years and there was never an issue, so why now? This was a review of systems and nothing more. There was no evaluation and management happening from my perspective. This was a safe, open conversation about my overall physical health, which I think is fair game in a preventative annual exam. The intent, the hospital records show that I specifically scheduled this visit weeks before as an annual preventative exam. It's not like I needed sudden care and I went in the next day because I needed, a cure for baldness. That doesn't make sense. The complexity. Wouldn't the doctor want or need to know about the whole patient concerns as part of good healthcare? Who is to say that an ongoing foot problem that maybe doesn't go away is not somehow connected to a more serious problem? As a patient, I don't know that. The doctor does. So shouldn't we be allowed to talk about anything? And consent. If I somehow breached this set of preventative versus regular visit guidelines, I certainly was not made aware of their existence before my appointment, that I violated them during the scheduling and the check-in process, and no one told me during the actual office visit that I could not answer the doctor's questions honestly or openly, or that prescriptions in these labs would somehow result in billable charges. Are you kidding me? This is ridiculous. Okay, this is gonna be a big problem for healthcare. If patients are surprise billed for their free preventative exam, they're gonna stop going in, and this can have huge and serious consequences later for patient care. It breaks the trust between the doctor and the patient. It burdens the mental health of the patient and the financial health. There's a connection there, right? It implies that I was somehow trying to be deceptive, so suddenly it creates an us versus them situation. Or maybe the doctor is engaged in miscoding or some type of unethical practice of overcoding. And more importantly, it negatively affects the patient outcomes and the quality of care. Because the next time, and if I think this is going to happen again, then will I go to the doctor quickly as I should? What actually happened to me months later, I actually had a random blood clot, and it took me 6 days to finally go in because I was like, oh no, I don't want this to happen again. I'm going to get screwed over by the cost here. And I thought it was a pulled muscle, and finally it wasn't. And by the way, I went into the same clinic, and I would have gone in much sooner had I felt good about my previous experience, that the doctor was not overcoding or there was not some type of unethical charges happening here. So that problem could have been a lot worse for me. Will patients schedule and go to their preventative annual exams if they are going to be billed for it later? And in my letter, I finished with something like this. I adamantly believe that nothing about my annual visit fell outside of preventative, enough to be categorized as a regular visit for the reasons that I mentioned above. How your hospital chart responds to this will determine if I continue care at your hospital or not. And by the way, I mentioned my family too. In other words, we have a lot of money invested in our future with this hospital, so us leaving should be a threat. And I said, I thank you for your time, and I eagerly await your response. Okay, so let's recap. I emailed billing, I emailed the clinic and the doctor directly and asked about this, and asked them very directly, will you please reverse these charges? And here's why. I reached out to the office of the patient advocacy through the hospital and had that letter sent to them, the director of this office, and also to the administrators of the hospital, because they need to know if there's some type of unethical or overcoding happening within clinics. They need to know about that. My demeanor, I was firm, frustrated, but always respectful. I did not use swear words or anything like that. But I definitely spoke in an impassioned way in my writing and on the phone, in the phone conversations that I had for follow-up. I also sent an appeal to my insurance company informing them of what happened and asking them to reverse the charges or to contact the hospital to have them reverse the charges. This is part of my free annual benefit through my employer. This should be free. I also sent letters to my representatives. Yes, I went that far just to let them know, hey, this is happening in our area and this needs to be on your radar. Patients are being billed for free preventative exams, and this is not okay. I also reported this through the Surprise Billing Act, although it does not qualify for reasons I will not get into. But a free preventative exam billing does not qualify under the Surprise Billing Act. But I did receive a phone call from them, and they listened to my story and gave me with some other ideas for what I could do. But ultimately, that didn't help much. And did you know that the state has an insurance division responsible for customer complaints? I also sent complaints to them as well. I threatened legal and even social media action to them. As my appeal took many months to make a decision, there was no process. I think it was sitting on somebody's desk, and I was growing more and more frustrated with this. Hey, this needs to be done. I started to hint at consulting my legal team and possibly going to social media about this important problem, which, by the way, I'm doing. I'm just not naming names or hospitals. Oh, and by the way, you're going to want to call the billing office and ask them directly, hey, this isn't an appeal. I've sent a letter. This is an official state of appeal. Please put a hold on my bill until this matter is resolved. And if they continue to send you threatening letters, you can call them and say, stop sending me threatening letters, or email them and say, stop sending me threatening billing letters. This matter is being appealed. I do not owe anything, and I will not be sent to collections over this. Please speak with your manager to put a hold on my bill as this matter is being deliberated. Okay, so the end result, finally, after all of this, finally I received a phone call yesterday that said, sir, we have come to a decision regarding your appeal. It was sent to an external board of review within the hospital, so not the clinic, but a team of people whose job it is to appeal such charges. And we have decided to waive these charges for you. We agree with you, and we are waiving these charges. And I said, Thank God that's a win. Now, was it worth months and months of angst and sleepless nights thinking about what I should say and what I should do next? Hey, I think so. 80 bucks is 80 bucks, but it could have been $2. The principle is what's important here. We should not be charged for free preventative exams unless that is made clear up front, before, and certainly during the appointment, not after. Okay, so this begs the question, how can you protect yourself from this happening again? Well, I think the first thing you need to do when you walk into that office, it's going to be a little awkward, but you need to say, hey, doctor, before we get started here, please let me know if I'm going to say anything that is going to bring me outside of these guidelines for my free preventative exam. I need to know what I'm going to be billed for if I somehow breach these guidelines. So please advocate for my financial health also. I would appreciate that. And the doctor's probably going to be pretty stunned because I don't think there's a lot of patients that ask for this. But they should. And doctors, more importantly, should be able to do that first. Beat us to the punch, doctors. You need to tell us, hey, I'm here to take care of your physical health, but I also understand that your mental and your financial health is at stake too. Healthcare is very expensive, and I'm going to advocate for you in all of these fronts. Now tell me what's going on. That's what doctors need to be saying. How can we get them from A to B? They're medical specialists. They're focused on the health and the physiology and the body. But there's also connections, and more work needs to be done about this to make sure that we are getting the best quality care for the most affordable price, and no unreasonable surprise bills later, especially for non-threatening free preventative exams. Now, I'm going to make an actual form and I'm going to put it on my channel where you can click it and you can print it off and you can actually read this example language to your doctor if that will help you. So use that form, share it with people that you know, because we need to start making some positive change here to make sure this doesn't happen again to you or other people. You need to contact your insurance company and say this has happened. Also contact your employer and report this instance if it happened to you. And contact your representative. And I think hospitals need to do a better job of training their employees, from the person who checks you in and schedules you to billing, to the actual healthcare professional, to the doctor himself or herself. They need training on how they can better advocate for us financially, given the climate of rising healthcare expenses in this country. So in the end, it's one person pushing up against a brick wall, but together, hopefully we can make sure this never happens again. Free preventative exams should be free. And if they're not, we should be made aware of that the contents of our conversation will be billed. We need to be made aware of that before our appointment and during our appointment, not after. And thank you so much. We'll stop the video there. Hopefully this has helped you out.